Be in the know.
So have you ever been to a health center?
Sure, I've been a couple of times.
How did you know where to go?
I just checked the clinic locator tool. By entering my zip code, I found all the health centers in the neighborhood. Then I just called the nearest one and set up an appointment. It was easy.
Do my parents have to come with me to the appointment?
No. Going to visit a health center is totally confidential if you are 16 or older, meaning you don't need your parents' permission to be seen, and no one will contact your parents before or after your visit. Your medical records are completely private and legally off limits to anyone else, including your parents.
What do I do when I get there?
You'll have to sign in, and the receptionist will give you some paperwork to fill out. You'll need to bring your ID and health insurance card. If you don't have health insurance, bring your birth certificate with your ID because you may be able to register for Medicaid services at the health center. Even if you're not eligible for that, most health centers have free or low-cost services available on a sliding scale.
Meaning even if I can barely afford ramen noodles, I can still get birth control and condoms?
Yep, exactly.
Will I have to wait a long time to see the doctor?
Well, it might not be a doctor. You may see a nurse practitioner instead. They can prescribe medication just like a doctor can. And sometimes there is a bit of a wait, especially if you don't have an appointment. But it's super important that you go for regular checkups if you're sexually active. Remember that you're responsible for your own reproductive health, not your parents, not your boyfriend, you.
But won't people think I have an STI if they see me go into a health center?
People go to the health center for all kinds of reasons. No one has to know that you're there for birth control. Your visit with the doctor takes place in a private room, and they never discuss your personal information in a public place, like a waiting room.
So nobody will know why I'm there?
Nope. You could be going to get allergy medication.
Okay, so what happens when I get called in for my appointment?
Your healthcare provider will ask you some questions about your medical and family history. Ask her about birth control and see what she recommends for you. Don't forget to ask about STI protection and testing too.
What about the actual exam? Are they going to, probe me?
Girl, where do you think you're going? An alien spaceship? For STI testing, a full pelvic exam is not necessarily required. They'll just take your blood pressure and ask you to pee in a cup. Some healthcare providers do require a pelvic exam before they will prescribe hormonal birth control, but some don't. The best thing to do is to ask if the exam is necessary when you call to make the appointment. Remember that you never have to do anything that makes you feel uncomfortable.
That's a relief. Anything else I should know?
Before you go, you should check out the contraceptive comparison tool to learn about all the different types of birth control. Remember that abstaining from all sexual activity is the only 100% effective way to prevent pregnancy and STIs. Here's a quick overview of some of the most popular types of birth control. Depo-Provera is a hormone shot in the arm once every 12 weeks. The shot is 97 to 99% effective at preventing pregnancy and does not protect against STIs. Ortho-Evra is a thin plastic patch that you place on your skin, usually on your lower abdomen or upper back. The patch must be replaced weekly. It is up to 99% effective at preventing pregnancy and does not protect against STIs. Birth control pills use hormones to prevent ovulation and must be taken daily. The pill is 92 to 99% effective at preventing pregnancy and does not protect against STIs.
Aren't you supposed to take a break from the pill every few years?
No, that's just a myth. There is no medical reason to take a break from using the pill. You can safely use it for 5, 10, even 20 years without stopping until you're ready to get pregnant. Here are a few more options for birth control. NuvaRing is a small flexible ring inserted into the vagina for 3 weeks in a row and taken out on the 4th week. The ring is up to 99% effective at preventing pregnancy and does not protect against STIs. Implanon is a thin plastic rod that is inserted underneath the skin on the upper arm. It is invisible and lasts up to 3 years. It is 99% effective at preventing pregnancy and does not protect against STIs. A condom is a thin sheath of latex or plastic that covers the penis. Condoms are 98% effective at preventing pregnancy when used correctly and consistently. Condoms protect against both STIs and pregnancy. IUDs like Paragard and Mirena are small plastic or copper devices inserted into the uterus. IUDs are 97 to 99% effective at preventing pregnancy and do not protect against STIs.
What about the morning after pill?
Well, the morning after pill is considered emergency contraception and should not be your primary form of birth control because you're going to have a birth control plan in place before you have sex, right?
Definitely.
But accidents do happen. So, if you have unprotected sex or the condom breaks and you're worried about getting pregnant, ask your pharmacist for the morning after pill within 120 hours of having sex.
Don't you need a prescription, though?
Nope. Emergency contraception used to require a prescription, but is now available over the counter if you're 17 or older. And guys can purchase it too. Just ask the pharmacist at any drugstore.
Great. Thanks for all your help. How do you know all this stuff anyway?
I learned some of it in sex ed in high school. Plus, I asked my healthcare provider a lot of ultra-personal questions when I was thinking about having sex for the first time.
Well, thanks for helping me figure out what to do before we do it.
No problem. Once you have a plan for protection, you won't have to stress about getting pregnant or getting an STI, and you can just focus on the fun stuff. Having sex is a big responsibility, and taking precautions to protect yourself makes it easier to just relax and enjoy the experience.
Whew, I'm gonna call the health center to make an appointment today.